Building bridges in healthcare isn't always easy, but some practitioners are making it happen. Today, I'm speaking with Jenifer Epstein, a chiropractor who has spent 20 years breaking down barriers building traditional medicine and chiropractic care. Her practice works hand in hand with Penn State Hershey Medical Center, proving that collaboration beats competition when it comes to patient care. We'll dive into how she's built a thriving referral based practice, the education gap that still exists between medical disciplines, and why she believes routine cases often lead to the best patient relationships. Jen, welcome to the show.
Thank you so much.
Yeah, absolutely. Okay. So, Jen, you've been practicing for 20 years and have built something unique, a chiropractic practice that actively collaborates with traditional medicine. Can you walk us through your core philosophy and what sets your approach apart?
Absolutely. So, I think that there's a little bit of a stigma that I think is getting much, less pronounced in healthcare, which is that there's this huge division between, what's considered traditional healthcare and alternative healthcare, medicine versus chiropractic, which to me makes absolutely no sense when I feel as though healthcare needs to be about the patient and what gives them the best quality of life possible and what ultimately helps that patient to be healthy. I do feel as though that, the whole alternative traditional, I just don't think makes any sense and has any place in that healthcare conversation. I think that whatever healthcare gets the best results for the patient in the least invasive way, I think is the right answer. And I think no matter what facet of healthcare you're in, that's what you should want for your patient.
Yeah, absolutely. Okay. So you mentioned that 20 years ago, working closely with hospital physicians wasn't common. What's changed and how did you go about building those relationships with like Penn State Hershey Medical Center?
So, a lot of the physicians that we work with, not just at Penn State, but we have several that, work through UPMC and WellSpan, and it's just become more of a referral, relationship. We have some spine specialist back surgeons who really want to give their patients other options before they do have to enter into more invasive procedures like injection surgeries, so on and so forth. So I think being the kind of office that is evidence based, is open to conversation, is open to referring patients that we feel may be candidates for surgery and really showing these professionals that despite what they may have heard or been taught throughout their education that there are absolutely chiropractors and, PTs and acupuncturists and people out there who are excited to be able to collaborate as long, as again, it gives the best outcome for the patient. So, we try really, really hard to, follow our schooling and make sure that we're doing really, really good, thorough exams with our patients. We do digital x-ray right in the office to make sure that we are treating appropriately, we're keeping our patients safe, and we're very comfortable making referrals outside of the office if there is something that we feel is outside of our scope. And finally, we do reach out to other providers. If we have a case that we're just not sure, it's something we haven't seen before, I love reaching out to other providers and asking, have you seen this? What's your take on it? Would love to collaborate and work with you. And it's, for the most part, really, really gotten us some just really beautiful collaborative relationships with other healthcare providers. There's always going to be a population of doctors that just simply don't know what it is that a chiropractor does, what our training is, and, kind of has this belief that, we're trying to overstep or that we're trying to get in the way or that we don't know what we're doing. So I don't think that's going to go away entirely. But I think that if you can set, your ego aside, I think if you can set the stigmas aside and get to know other providers and what we can do to work together, I think it just makes huge strides in healthcare. And like I keep saying, it benefits the patient. And that's always the right
That's a
answer.
goal, right?
Yeah.
Yeah, yeah. So what do you think is still missing in terms of maybe education between chiropractors and
What's missing in terms of education on both ends, right? So I went to school 20 years ago, but just, I hire younger chiropractors to work with me. And so I know that this is still a problem, but in our program, there's no dialogue around how do you effectively communicate and work with the medical community for the benefit of the patient. I know because I have a lot of physicians who I work with and physicians who are patients, that there's no messaging in medical school like, hey, listen, here's how you work with chiropractors. Here, when you are going to consider a chiropractor for your patient, here's some things you need to ask to make sure that where you're sending them is the best place for your patient. And there's no support, there's no education, there's no dialogue on either side of the coin. And it really is a shame because at the end of the day, the patient suffers not having providers that are willing to communicate and work together.
Would you mind maybe sharing a couple of those things that an MD should ask or to kind of help prep to whether they need, chiropractic care?
Absolutely. So I think that, if a, PCP or a spinal surgeon, orthopedist is considering sending a patient to a chiropractor, ultimately, I think the provider should start reaching out. I think, there should be some onus on the provider to get to know chiropractors in their local area that they're comfortable working with. I do that. I don't go to Google and say, who's the best orthopedist in Hershey, Pennsylvania. I talk to my patients and I say, who have you worked with? What's been your experience? What's their bedside manner? What exams they're doing, so on and so forth. Because it's very hard for me. I can't call any doctor's office or hospital and get a doctor on the phone to talk to, which is pretty sad. If let's say an orthopedist or PCP calls a chiropractic office, you better believe most of us are going to hop on the phone and have a conversation. But, ask us, do you take x-rays in office, or at the very least refer out for x-rays before you treat your patients? Are you actively and consistently doing full ortho neuro exams on your patients? What types of services do you offer? Do you offer multiple techniques when it comes to adjusting patients based on, the case or the type of patient, right? Are you willing to sit down with me for, 15, 20 minutes and explain to me how you might be able to help my patients, so on and so forth. Um,
That's
there
great.
are
That's
there are
huge.
people who cut corners in absolutely every facet of medicine and healthcare, period. So I'm not throwing anyone under the bus, but there are people who are trained to do orthopedic and neurological examinations on patients who are not doing them. Um, and there's all kinds of reasons why, right? I mean, in order to be able to cover overhead, some people feel like they have to see hundreds and hundreds of patients a day and they're rushing through and there's pressure. And that's a whole nother podcast, right? About healthcare in the United States and pressures on physicians and all that. But, take a second and get to know who's out there and what it is that they're doing and the type of healthcare they're providing for patients.
So you track an interesting metric, the ratio between wellness patients and acute patients. And I know that you see quite a few patients a month. How did you shift patients from fix me, right, when I'm broken to try to maintain or maybe preventative or just keep me healthy?
So it's an ongoing kind of piece of education, right, that we have to provide our patients. So, when it first started in practice, a lot of our patients were coming in because they have an issue. They have pain, they have dysfunction, they have something that's been going on for years. They've tried everything and nothing's worked, and so on and so forth. So as they're going through acute care, we're explaining to them, basically basic human anatomy and physiology and how your body is designed to heal, and the things that we do to our body, what we put in it, the environment around it, all impact how our body heals or not. And, I always use dentistry because I think dentistry is just brilliant, right? I mean, you don't stop eating because you don't want to have to maintain and brush your teeth every day, right? I mean, you have to keep living life, but you also have to take care of yourself. The same goes for working out, nutrition, education, relationships. You can't not work at things, and health is absolutely no different. So, our patients who are coming in for acute care, if they've been sitting at a desk for 20 years, now they're experiencing sciatica all of the sudden. Our job is to not only get that patient's symptoms under control, but to create an environment where they can stay well. And that's healthcare. One of my favorite things to say in the office is, I want you to come in as boring as humanly possible. I want you to come in and I'm asking about your headaches, your sciatica, your knee pain, your neck pain, your back pain. And I want you to say, nope, nothing, nothing's new, nothing's going on. And we spend that time,
Right. I love it.
talking about something else because you
Yeah.
feel good, right? I mean, if we have somebody
Yeah.
who's had headaches and migraines for
Success.
20 years and they don't
Yeah.
anymore, why would you stop what's helping you? That's just silly, it's
Yeah.
just so silly to me, but that's just our culture. So now, 80% of our patient visits are people coming in that want to stay well. I think people are tired of just getting help when they're sick or injured.
Right. Yeah. No, and mean, I think it's important to have that. It's got like maintenance, kind of like just we use the car analogy with changing the oil, right? It's like you
Literally.
don't wait until you see smoke coming out the back, like
I mean,
get it changed.
but
You
right, but then you're
could,
going to pay more because your car's
yeah,
broken, or you're not going to
right,
brush your teeth. So now you got to pay more to get the cavity to deal with the
yeah,
cavity, right? So I mean, it's
yeah,
not new anywhere else, but for some
yeah,
reason, my gosh, you're telling me I have to keep going to the chiropractor. Yeah, you do. Your body needs it.
yes. Definitely. So, like many healthcare providers, you're dealing with insurance challenges. You've shared that you've cut down to only three. I don't know if that's changed, but three insurance companies. How do you balance like accessibility for patients while still, trying to maintain a profitable practice?
So this is multifaceted. I'm so excited to share that since we spoke, we decided to go out of network with insurance. So that will be happening actually the beginning of September. And we are so unbelievably just blessed and excited to not be held back by insurance anymore. We as providers can finally start to make decisions about how to treat our patients properly without being questioned by people who have not had a single day of education in our space in healthcare, not being challenged by people who are practicing medicine without a license and so on and so forth. But, ultimately, this is the US anyway, average deductibles are almost $2,000. I can put somebody on a complete whole entire 12-month, 1-year care plan of chiropractic for less than that. Do you know what I'm saying? So
Yeah.
chiropractic care is not expensive. One MRI of one body region, if you pay that out of pocket, is $3,500. So, for me to charge $65 for an adjustment, I think it's just silly to even have. I have patients coming in with $65, $70 copays. And because I'm in a contract with some insurance company, I'm sorry, Susie, I got to charge you $70 instead of 65 because I'm in a contract with your insurance company and I can get in trouble if I don't do that. Um, I think we're very, very, I hate to use the word brainwashed, but I feel as though we're so conditioned to rely upon health insurance for just everyday health care. If you need to get surgery or have a baby, yes, like by all means, leverage health insurance. Please, please, please do because those costs are astronomical. But, insurance companies have absolutely zero interest in keeping people healthy. And again, I'm really focusing on the United States because that's where I'm at. If you are ill, if you are injured, you are more profitable. And we're not playing that game anymore. And we're
Well
very
said.
excited. We're very excited to continue making care very accessible from a cost perspective. But we've also taken it a step further. We provide super bills and we have even found all of the necessary documentation to help our patients submit that so they don't have to call their insurance companies, search online. We have forms ready for them so that they can get stuff, for out of network benefits as fast as possible. So we're thrilled.
Great. Yeah, kudos. That's awesome. Thank you for sharing
Yeah.
that. I'm glad. Nice to hear that update.
Yep.
So you touched on this a bit earlier about X-rays, and so I know you're pretty adamant about doing digital X-rays despite pushback, and I kind of had this question around insurance companies, but I'm not sure it's still relevant. But can you talk about why you won't compromise even just doing X-rays, and now it sounds like you've dropped or you're going out of network for insurers.
Yeah, absolutely. An insurance company that shall not be named, basically contacted my office and said, you really don't need to be, taking x-rays of patients and I can send you some articles on why. And, and we're not going to cover it and so on and so forth. And it was one of the most infuriating conversations I've had. So obviously there's contraindications to taking x-rays, right? So obviously we keep that in mind. There's certain cases where we don't. Um, but in most cases, I want to know. You don't know how many times we've had a new patient come in and completely forget that they have some kind of an injury, completely forget that they have, cardiac issues or, other issues going on that, you actually can see right on an x-ray or can be diagnosed. I've sent patients immediately to a neurosurgeon for consultation because they had zero neck pain. It was the worst neck x-ray I've ever seen in my life. So if I would have put my hands on there and manually adjusted this person, I could have hurt them, and I'm not willing to
Mm.
risk that patient's health and or life because they didn't have any pain there, and I didn't take a few minutes to take a look and make sure it was safe for me to do that. Even within the chiropractic community, there's a lot of back and forth, right? If you can do a great exam and you know what you're doing, you shouldn't have to take x-rays. Well, unfortunately, there's just a lot of things that don't necessarily manifest in outward symptoms, haven't been diagnosed yet, where a patient just simply doesn't remember, that can put them in a higher risk category. So I'm not willing to sacrifice that. And quite frankly, I really don't care if the insurance company wants to cover it or not, because I know that if I do hurt my patient, they're not going to call me and say, hey, let me cover, your malpractice insurance for you. Let us come advocate for you that you're a great doctor. They'll be nowhere to be found at that point. And quite frankly, we charge a lot less than pretty much anywhere else to take some x-rays for somebody anyway. So it's the right thing to do. And it's just not something I'm willing to compromise on.
It takes me back to 17 and I was in a car accident. It was my first, my dad had already been going to a chiropractor for years. And it was my first introduction to like, well, you're going to come see my chiropractor, you know? And I just, because you brought up that x-rays, I remember that he used to always take it and he would put it up on the wall and he would look at it before he gave me that adjustment. Is that kind of something like what you're doing, or are you
That's
taking
what
them
we
and are
did
you,
when I first started, a few years ago.
yeah?
Yeah, we would go in like the dark room with the little, it's not like
Well,
a,
he had a like this window type thing, and he would pop it on there.
yeah,
But
no, no,
but
no,
I
no.
would
I
say it
mean,
was kind of dark in the room, though.
for sure. Now we have
Yeah.
just we have a computer and then we cast it up, onto a
Okay.
TV. So every patient's second visit is called a report of findings. And so we
Yeah.
sit there and, we go over the results with them, answer any questions, and that
Okay.
really, it's not everything that
Yeah.
dictates what we recommend for care, but it helps guide us and it helps rule out certain things. And it also helps us, determine, hey, listen, you're safe to be treated here. I can help you, but did you know this and this? I'd really
Mm.
like you to follow up. You've got some major calcification in one of your major arteries. I'd like to make sure that you do have a great cardiologist. You do follow up with them, so on and so forth. There's things
Yeah.
that we want
It's
to make sure
beyond,
patients
right?
have. Yeah.
It
I
goes
just think
back
it's
to
due
making sure
diligence.
that they're good. Yeah. You're trying to help them out.
It's called do no harm, right? So, I mean,
Yeah.
our goal is always to do that. And here's the thing. I will never forget. I had a conversation with a doc and we were comparing malpractice. And this particular doctor, I think I don't know, it was five figures, okay, a year in malpractice insurance, and I think mine at that time was about $1,800 a year. Okay, so what chiropractors do is one of the safest things you can have done. Okay, the risk is low no matter what, and that's just fact. It's lower cost, lower risk. It just is that you can't, really contradict that in any way. But to be the best doctor for my patients, I need to do my due diligence ahead of time, and I feel it's the right thing to do.
All right. So if you had a magic wand, right, what would you change about the healthcare? And I can kind of
How
continue
big's
that.
my
So
wall?
yeah, and like, well, like for other practitioners listening, right? Who would want to build better relationships with traditional medicine? Like, what's your advice?
I mean, I just had this conversation with a patient yesterday. I mean, my dream would be to have, just large maybe facilities kind of all over the place where, people would come in on their birthday every year, right? And they would just get the works, right? They would get full spine, digital x-rays. They would get full blood panel. They would get maybe an MRI. They would get a DEXA. I mean, just they would get the works and they would know what their body is doing and what it's saying, a GI map, right? Just everything that their body is doing and how it looks, and be tracking it to see changes so that you can isolate any potential issues that may arise ahead of time. And in that facility, you'd have maybe one or two of each specialist that all met and talked to, you know how attorneys, like, they'll all sit around a table and they'll discuss like big cases together, right? And they all talk and they all communicate and they co-treat, and the patients get the benefit of all of these providers working together, and they catch things ahead of time, and they don't have to go into, their PCP's office or a specialist's office at age 75 with a medication list 3 pages long, because they've taken care of themselves their whole lives. Do you know what I mean? So
Yeah.
I just, in my head, if I close my eyes, like, that's what I see and want to be a part of. And I just don't know that that is ever going to happen in the
Yeah.
States anyway, but that's kind of like my dream.
I love the idea that you shared about even tracking more too, because I've been, and I'll share off podcast with you, but yeah, there's some with the advancements in AI and stuff. There's some really interesting things that we can, you know, we all hear a lot of stuff about the things that you can wear, but there's just some really cool stuff out there that I'm even learning about. But I'll definitely, share with you off podcast. But it's just exciting to be able to like, whoa, we can find out that about our bodies and like in advance and like learn that now and work on preventative and like keep ourselves out of the hospital kind of thing. Like wow, like imagine that, right? So,
Wouldn't
all
you
right,
want that? I mean, how often do we talk about,
yeah,
oh, if you go to the ER, you're going to be sitting there 8, 10, 12 hours. Well, guess what? You wouldn't, right? If you had more people who are being preventative up front. I mean, when did
uh,
prevention become alternative? That's the dumbest thing I've ever heard.
yeah,
Alternative should be medicine. Alternative
yeah,
should be getting shots and surgery. Not that they aren't miracles in their own right, not that they aren't necessary or do wonderful things, but how are we so backwards? I don't want my surgeons to be exhausted because they've been awake for 3 days. That's terrifying.
yeah.
That
That's
doesn't make
scary.
any sense to me. It's crazy.
Yeah, that's definitely scary. Okay, so for listeners who want to learn more about your practice or you try to connect with you, tell us like what's the best way to reach out.
Well, our website is hersheyfamilychiropractic.com. That's really the easiest way. We've got all of our contact information on there, Facebook page, TikTok, every everything
Right,
else
yeah.
we
On
have
all
is
the
on
social
there.
handles.
Yeah, it's pretty easy to find us and get a hold of us, but we're located right near Hershey Park. Some people know what that is, but we can see the big roller coasters right outside our office and everything. So we're pretty easy to find.
Okay, great. Well, thank you so much for your time, Jen. I really appreciate this.
Absolutely. Thank you so much for having me.
Thanks for tuning in to this episode of The Wellness Grow Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.